Are you confident that your medications will travel safely with you, especially when you're enjoying new places or getting away for a well-deserved break? Let's make sure you are. Hi there, I'm your friend and neighbor in travel, and today we're talking about traveling with medication. When you're over 60 and taking a few prescriptions or regular treatments, traveling does raise the stakes a bit. Medications can be lost, delayed, exposed to heat, or simply forgotten at packing time. I once took a weekend trip and nearly left my morning pills in the hotel safe. Thankfully, I remembered before sunrise. Preparing ahead means fewer worries, more fun, and greater peace of mind. Meds means any prescription or over-the-counter drug you take regularly, from blood pressure medicine to arthritis relief. Traveling means any trip away from your regular routine. A flight, a cruise, a road trip, a week at the beach. When I talk about traveling with medication, I mean organizing, packing, and planning so your medicine stays safe, effective, and accessible. When in doubt, always ask your doctor or pharmacist. At least a few weeks before you go, talk with your doctor or pharmacist. Explain your trip, how long you'll be gone, where you're headed, and how you'll travel. Ask if your dosage or timing should change because of time zones or schedule shifts. It's also a good idea to ask whether you'll need a note listing your medicines, doses, and why you take them, especially if you're traveling internationally. Many countries appreciate having that documentation handy. It helps you get through customs or security smoothly. Write a list of every medication you take. Name, dosage, how often you take it, and why. Keep one copy at home and one with you in your carry-on. Take a photo of it on your phone just in case. Include your doctor's and pharmacy's contact information and note any allergies. Write it clearly so it's easy to read even in dim light. I once scribbled mine on hotel stationery at midnight. Not my finest moment. Do it ahead of time and you'll thank yourself later. Keep your medicines in your carry-on bag, not checked luggage. If your bags get lost or delayed, you'll still have your meds with you. Pills are allowed in both carry-on and checked bags, but it's always safer to keep them close. If you carry liquid medicines, gels, or inhalers, you can bring more than the usual limit, but you'll need to declare them at airport security. Use the original labeled containers when possible. If you use a pill organizer for convenience, keep the original bottle somewhere in your bag so you can show labels if needed. Bring a few extra days of medication beyond your trip length. If your trip is 7 days, pack enough for 9 or 10. Delays happen, and it's better to have a cushion than to run short far from home. Keep your medications in a small, clearly marked pouch in your carry-on. Label it meds so it's easy to spot. That way, you won't be digging through layers of clothes to find your pills when you need them. If your medication needs cool storage, check your destination's options. Hotel mini fridges or small insulated bags work great. Some medicines are fine at room temperature, but others, like insulin, need cooler conditions. Planning ahead keeps everything stable and safe. When you're at the airport, arrive a little earlier than usual in case you need to talk to security staff. At the checkpoint, tell the officers that you have medications or a medical device. They'll help guide you through the process. Keep your medicines in your carry-on so they're accessible, even if your checked bag gets delayed. If you use devices like an insulin pump, infusion device, or cane, allow extra time. These may need additional screening. A friendly smile and clear communication go a long way. Traveling across time zones can be tricky for medication schedules. Different sunrise times, meal hours, and routines can throw off your timing. Try to think in hours rather than local times. For example, I take this every 12 hours instead of I take this at breakfast. Bring a small notebook or use your phone alarm to keep track of doses. You can set one alarm for your home time zone and one for your destination. And if you're unsure about adjusting your schedule, ask your doctor for a simple time zone plan before you go. Once you arrive, find a safe, stable place for your meds. Use a mini fridge if they need to stay cool. Avoid leaving them in a hot car or on a sunny windowsill. Heat can affect how well they work. Keep medicines in their original packaging when possible, or at least label them clearly. If you switch to a pill organizer, note which pill is which to prevent confusion. And if you're traveling with pets or little grandkids, make sure your medicine is out of reach of curious hands or paws. If you're traveling abroad, Check whether your medications are allowed in your destination country. Some common U.S. prescriptions are restricted elsewhere. Carry a copy of your prescription or a letter from your doctor and double-check with the embassy or travel health service before you go. For international trips, it's always wise to pack your medications in your carry-on and bring backup documentation. A little paperwork can save a lot of stress. And remember, this is general information. Check with your healthcare professional about your own needs. Many seniors make simple mistakes when traveling with medication. Some pack everything in checked luggage and lose access when flights are delayed. Others forget time zone changes and take doses too early or too late. Sometimes people leave pills in a hot glove compartment or mix up dosages in a new organizer. These are all easy to fix with a little preparation. Carry meds with you, label them clearly, and store them safely. Learning from these small errors makes travel smoother and less stressful. Here's something you can do today. Pull out your medications and make or update your list. Pack a small pouch labeled Travel Meds and check that it fits in your carry-on. Then call or email your pharmacist to ask if any of your medicines need special storage or a travel letter. These quick steps will set you up for success on your next trip. Right now, grab your medication list and look at your next trip on the calendar. Ask yourself, do I have enough extra medication? Are my meds easy to reach? Have I let my doctor know I'll be traveling? Do one of those things today. Maybe call your pharmacy or set a reminder on your phone. That one small step will give you peace of mind and confidence for your upcoming journey. Traveling as a senior doesn't mean you have to worry more. It just means you plan a little smarter. With some preparation, you'll be free to enjoy the scenery, make memories, and maybe discover a cozy cafe that welcomes both you and your furry companion. Also, remember to give yourself breaks while traveling. Stretch your legs on long trips, drink plenty of water, and try to maintain your usual meals and sleep patterns. Even short walks around the airport or hotel can help circulation and energy levels. Consider packing a small first aid kit along with your medications. Bandages, pain relief, or any extra items recommended by your doctor. It's a little extra effort that can save you a lot of stress if something minor comes up. If you're taking multiple medications, a simple color-coded system in your organizer can help you keep track. For example, mornings in blue, afternoons in yellow, evenings in green. This makes it easier to spot if you've already taken a dose. And don't forget to enjoy the journey itself. Take time to notice small joys, a scenic view, a friendly conversation, or a new snack. Planning for your health doesn't mean you can't have fun. In fact, the more prepared you are, the more relaxed and present you can be. Safe travels, my friend. May your bag be light, your mind at ease, your body cared for, and your heart open to new adventures. With a little preparation and attention, traveling with medication can be stress-free and even enjoyable.